You're listening to Health Professional Radio with Wayne Buckler. Today my guest is Hunter Leonard. Hunter's got many years of experience as a strategic marketer, particularly in the pharmaceutical space, and has a keen interest in ethical marketing. Hunter, welcome to Health Professional Radio.
Thanks, Wayne. Happy to be here.
Now, Hunter, many of our listeners are clinicians and along the clinical education pathway, there's very little study or education goes in regarding marketing and how it works. What's your insight into strategic marketing of pharmaceuticals?
Okay, so marketing of pharmaceuticals, like pretty much any other product in any marketplace, is all about matching the need of a customer or a consumer or a patient in this case with a product that will help them with a condition or a need or a want that they have. So marketing is really supposed to be about all of the matching of those needs with a product that satisfies those needs. For the company, that is to be done in a profitable way because the company needs to make a profit to continue its work in a particular area or research, etc. For the doctor or the health professional and the patient, they want something that then is effective with a minimum number of side effects, although of course most medicines, no matter what they are, have some kind of side effect to them. So it's a matter of finding the right balance of those two things in the management of a particular disease.
And do you think marketing in pharmaceuticals is done differently to general products?
Yeah, there's definitely a difference. One of the main things is that if you're dealing with a general consumer product, the marketer has probably more tools available to them or more choice in the way that they would market a product. Normally in pharmaceuticals you have the government of the country at hand is usually involved in the regulation of the products that are available at the start, and also then the way they can be promoted depending on the country. So often products won't be able to be promoted directly to the consumer. They're promoted via the medical professional audience, if you like, which is where sometimes the ethical problem can be with that particular market, and has been a focus in many countries over the last probably decade or so.
And what do you see giving rise to the ethical dilemmas in pharmaceutical marketing?
Well, one of the key things that's been this is from my viewpoint, of course, personally, is that because I have an interest in ethics, is that there is not all, but some companies have ended up in situations where they seem to be inappropriately incentivizing the health professional to use their product, which places the health professional in a difficult situation because they are then not seen to be using their own clinical judgment as opposed to what the last sales representative that called on them had said about a certain product.
Now, this has made media coverage recently in Australia and in other countries. Is it a case that this process of incentivising prescribing doctors can go too far?
Totally. I think that very strongly can and does occur. I mean, in the form of, there's a lot of regulation on this now, but still the form of taking doctors to conferences or having doctors paid honoraria as part of an advisory group or given samples of products even to use can cross that line of presenting a product and its clinical benefits, crossing into what could be seen as an inducement to prescribe that over another product that might have similar benefits, if you like, and therefore the person with the most dollars or budget could win that game, which is not necessarily fair to the health professional or the patient themselves.
Now, there's been anecdotal stories around, I guess, for years of the gifts and incentives and, as you say, conferences and dinners and so on and so forth. Is there a line, and how do you determine where that line is?
Yeah, look, I think there's a line. I think both parties have an objective, and I think the line is that the product's got to be presented correctly and fairly, and there are, within many countries, and Australia included, good governing bodies and membership of ethical pharmaceutical companies who do toe the line and make sure they're presenting their products in a professional way. But not all companies are subscribed members as well, so you need to have that line very carefully drawn, and I think the product should be presented fairly as to what it actually does. There's been many instances too where brands have come to market and then it's found later that those products have significant side effects or otherwise, and then they've been removed from the market, and when the investigation has gone on, it's been found that the company has in some way overemphasized the benefits of the product in order to get it to market. So I think at the head of those companies, and as I said, many are very ethical, there has to be that standard of, let's say, due diligence and care for the end user rather than just the profit side of it.
Yes, but I can understand why pharmaceutical companies have a dilemma here, in that in most sales environments there's everything from commissions to incentives and rewards for both salesmen and for sellers of products. At the kind of blunt end of the spectrum is just the profitability, that the electrical retailer sells you a particular brand because he makes a profit on that brand.
Totally.
In a world where incentivating prescribing doctors is a routine, how does a pharmaceutical company draw a line about what they're going to do and not going to do without, in fact, just going broke and leaving the field?
Sure. Well, I think it probably comes back to more the scientist than the marketer. The true success of a pharmaceutical company or a natural health company is to find uniqueness, and there is uniqueness out there. When you get into situations where you've got many me toos in any market, then the ability to differentiate moves away from the scientific benefit of it to the patient into more of a commercial arrangement, if you like. So if you haven't got something that's uniquely offering the patient some benefit, then you're left with little to succeed. So it probably comes back to the fact that the company has to invest in looking for that uniqueness, and if they haven't got uniqueness there, then maybe it has to be in being more ethical or being a better corporate citizen that allows them to become more successful than the similar competition. There's many ways that good, smart, strategic marketers and others within businesses can find uniqueness, and it doesn't have to be in over-incentivizing or over-promising on a product. The difference in pharmaceutical, as we all know, is that you're not selling a stove that gets taken home and will still do the same thing. You're selling something that someone's going to take for an illness or a disease, so you definitely don't want to be crossing the line in regards to that.
Hunter Leonard, a strategic marketer in pharmaceuticals and a man with a keen interest in ethics in marketing. Today we've uncovered some, I guess, interesting dilemmas for pharmaceutical companies and, to a lesser extent, for clinicians who are on the receiving end, particularly if they're prescribing. There doesn't appear to be an easy answer here, Hunter.
No, but I think if you can go to the book of ethics, the best place and the best answer comes if you feel like it's going to cross the line, then you've got to be a bit smarter and look for another alternative. That's my opinion anyway.
And we thank you for that opinion. It's been a pleasure having you with us this morning. You've been listening to Hunter Leonard, and we've been discussing ethics in pharmaceutical marketing. Hunter's a strategic marketer with an interest in ethics. There's a transcript of this interview available on our website. It's at www.hpr.fm. You can also listen to the audio archive on SoundCloud or YouTube. This is Health Professional Radio. My name's Wayne Buckler.